Well, I like to do load testing before I think if an NTI is safe to use or not. Here's what that's all about. Rotate open. You place an anterior jig and you have the patient squeeze on it and it hurts them. Don't use an NTI. Load test failed. No, maybe you had them too far open. In what world do you put a hard thing on someone's teeth, have them squeeze on it without modifying for vertical dimension, for the degree of rotation? If you can reduce this down and now they bite on it and it doesn't hurt, do they pass the load test? You can make anybody fail a load test, just make the discluding element bigger and it'll hurt their joint. So, too big, hurts their joint, or you could do it so it doesn't hurt them. I'm not surprised that Mark Piper's first NTI he saw turned him off because it hurts joints. And he sent me the picture. I go, look, Jim. I go, Mark, dude. I don't count that as an NTI. I count that as a big blob of plastic that has too much vertical dimension. Because if you bite on that, that's going to hurt the joint. There's too much vertical dimension, too much rotation of the condyle. So if you had a jig or something like that, and this is how I do my occlusal adjustments. I put in an NTI device, set it at the right vertical dimension, so when the patient moves side to side, I should have daylight freeway clearance side to side. But if there is a big goofy palatal cusp, off it goes. I don't even mess around anymore with seating to CR or any stuff like that. I take my NTI and I whittle it down till I got daylight disclusion everywhere, but on that one, away it goes. Here's an interesting study in a neurology journal, Lancet. Actually, it's a medical journal. 62 consecutive subjects all have a chief complaint of chronic headache. Everything's been ruled out. Had it between 15 and age 30. More than half of them, it's been for 5 years in a row. Already consulted with several doctors without relief. It's usually bilateral. Now and then unilateral. That is the NTI population that's symptomatic, that most splints don't help. Those guys. We've done a study on those guys, but this isn't the study, because this study, they woke with a degree of headache. After 6 weeks of wearing this special nighttime device, 68% are resolved, some are better, some not. Real similar to the NTI results that people get. So 3.5 years later of wearing this device, they're still fine. It doesn't wear off. This was done in 1960 with an anterior biplane. So it's not like this is new news to anybody, except that thing there is not manufactured and marketed by a corporation. It's made in the chair. It's made by a lab. Suddenly, NTI guy comes along and prefabricates something that makes the dentist job easy and simple, less time, and suddenly, ooh, you're marketing. You know, that's why the NTI. So this information doesn't get disseminated because there isn't anybody to promote it. That's where the NTI comes along. All of a sudden, we're promoting, you can help these people efficiently